is Sean Riley, and I am the Program Coordinator for TransBuddy at the Program for LGBTQ Health at Vanderbilt University. TransBuddy provides trained peer advocates for transgender patients who are coming for doctor's appointments or other healthcare-related services. Whether you're looking for something that's related to medical transition, such as hormone therapy, or something completely unrelated, like breaking an arm or going to an ENT, we are here to help support any transgender patients that come through our doors. The TransBuddy program was organically created through the efforts of transgender people and continues to consistently be led by trans people in Middle Tennessee. The TransBuddy program is a one-of-a-kind in the nation, and institutions are looking to Vanderbilt to replicate and expand programs like ours. We do this work because we know that transgender patients face negative health outcomes at higher rates than their cisgender peers. Along with this, they face stigma, discrimination, and lack of healthcare access. This particularly affects transgender women and transgender women of color, but impacts everybody on the transgender spectrum. Knowing that many trans folks have experienced discrimination in the healthcare system and the enormity of the task of navigating health resources, we are here to help.
My experience has been very positive. I feel really honored often to be invited into people's lives and to be invited into some pretty intense experiences that they've had. And people have been really open and honest about their stories, and I've had a really great time getting to know people and feeling like I'm a part of their experience and learning from them. So most of my experiences have been visiting people in the psychiatric hospital here, which has been really great. And the way that TransBuddy is set up, we're not seeking to find solutions often for people's problems. We're just seeking to be there and to accompany and to be a friendly face, and to be a non-medical face in a place where everybody coming in the room is going to be a healthcare provider and may be unsafe. So I feel really honored that people have trusted me with their experiences and trusted me to come talk to them and be with them.
I joined TransBuddy because I know that for most people, accessing healthcare and visiting with a healthcare professional is intimidating. And so for trans individuals who are facing additional levels of discrimination, poor access to healthcare, and trying to find a provider who's going to take symptoms seriously and who's going to treat them with respect, it adds an extra layer of understandable, intimidation and difficulty and hardship. So when I saw this program, I thought this is really fulfilling a need in the community. My experience being a buddy has primarily consisted of two roles, one of which is answering phones and connecting people to resources that way. And the second way that I've been involved is I've done some visits at Vanderbilt Psychiatric Hospital. And one of the things I love about the program is that it's not really a cookie cutter, one size fits all type program. I'm not just in one role. I'm really centering the individual's experience and what they want and what they need at the time that they're calling. So if I'm going to the psych hospital, sometimes I'm just there to chat, hang out, etc. Sometimes I'm there to be always observing kind of how hospital staff are interacting with the individuals, and again, using correct pronouns or treating the individual with respect. And so I really like that my experience is again, varies depending on what the individual seeking services wants. And so it's not just kind of here, I'm an expert, here's this is what we're gonna do. So that's been a really cool part of my experience. Also going to Vanderbilt Psych Hospital, I am a mental health provider myself. And so to be able to kind of step out of that role and just be there for someone, not in this clinical way, has been really cool.
My favorite part of being a TransBuddy is hearing people's stories and laughing and giggling with people and making people laugh when they're a little anxious or nervous.
My favorite part of doing this work is the people that I get to meet, fellow volunteers, coordinators, and the individuals that I've just met in the course of doing this. It's been incredible. So making those connections.
I would describe TransBuddy as radical accompaniment because, again, it's not I'm not a social worker. I'm not coming in and trying to solve people's problems. I'm just trying to improve people's experiences just by existing in their space. and being with them.
If you're a transgender person looking for support in navigating Vanderbilt's health resources, you can call our number at 615-875-2833. Once you've called and told the operator that you're looking for a trans buddy, they will connect you to our on-call trans buddy, who will be able to answer any questions and accompany you on doctor's visits. If you're a volunteer who is interested in working with Vanderbilt's program for LGBTQ health and the Trans Buddy program, you can go to our website, vumc.org/LGBTQ. There, you can explore all the different programs that we have to offer and find the specific application for the Trans Buddy program. Once you have applied, myself or another staff member will reach out to you with next steps. We have trainings throughout the year to help support you in your support of trans patients and give you more information about the LGBTQ program.
I think if you're somebody who's considering volunteering, go for it. The training was excellent. Again, the community is excellent. This is, I've been nothing but impressed, which I don't know why it matters what I think. You don't know me, but anyway, I would say go for it. It's such a cool program.
I'm really, really excited to be a part of this program, which is the only one as far as I know, and I really hope that other trans buddies can take their experiences here and go other places and start other kinds of models of radical accompaniment in healthcare. I'm really excited to see where this goes.